Well, good morning, good day, and good afternoon to our viewers. This is Charles X. White, your host. We are back again for more community views and solutions. As we have mentioned on various other interviews, that this is the scholars, scientists, and practitioners portion. And if anyone says, well, look, you left out the citizens, we put the citizens in the category of practitioners because they have a multi-function in the research and the findings that we come up with. So this is Charity Productions Get Ready series, and this is for 2023. And then we also are commemorating 20 years with the Community Partnership Exchange Breakfast. So this is an exciting time for us with the 20 years and getting ready for 2023. This whole effort comes under the title of community science. We have a lot of problems in the Black community that are systemic and, in my opinion, politically designed. And what we have to do is find a common tool, tools, to get out of it, and the only one that seems to be yielding results is science. Science takes away the irrational, emotional, impersonal, not the impersonal because it's clinical. We want to be able to use math and science to get us out of this problem and navigate to a safe place with public health and public safety. And with that said, we want to introduce our two scholars and scientists that we have with us today, which is Dr. Jennifer Horney from the University of Delaware, founding director of epidemiology for the University of Delaware, and Garrett Sansom from Texas A&M University. People do ask me, are you a satellite for Texas A&M? Well, not yet, but we're working on it. He is also a professor, and his concentration is public health. Now, what brings us together today is that these are the principal investigators that did a study with and for and on the Community Partnership Exchange Breakfast in 2017 after Hurricane Harvey. That particular piece of research was titled SF12, and it was a national study model. So we want Dr. Horney to give us some technical information as well as for lay people's understanding, what is a SF12 study and the benefits as related to your findings with the participants at the breakfast. And then we're gonna also include Dr. Sansom in and with his role as it related to that. Dr. Horney, welcome, and thank you for being here with us. Kind of give us a quick overview, if you will, of who you are. You know, you transitioned from Texas A&M. Just give the audience a feel for you.
Sure. Thank you for having me again today, Charles. My name is Jennifer Horney. I'm a disaster epidemiologist. For about 20 years or so, I've been working in the field with residents, community stakeholders, public health practitioners, and other emergency responders to try to figure out better ways to assess the public health impacts of disasters. And the evolution of that has come a long ways from when we were sort of going into the field and trying to hand out tarps and water and ask people what they needed to the work that Garrett will talk about later, where we really integrated with residents and community groups, taking environmental samples and doing surveys and putting all kinds of data together to get a whole picture of the really extensive impacts of disasters on communities that go on for a long time after the immediate disaster has passed. So if I were to talk a little bit about the SF-12, the SF-12 is a standard 12-item questionnaire that's used to measure self-reported mental and physical health. And the reason that we use that quite frequently is because we can compare the reported mental and physical health of any group that we're working with or studying to a national average, which is 50. And so if your results are less than 50, then you have poor physical and mental health in average. And if it's greater than 50, then you have better mental and physical health. So in this case, and also in a study that I recently did working with a mobile health unit that's trying to reach communities that are underserved by brick and mortar healthcare facilities, we're trying to figure out if the right groups of people are being reached by the right interventions. So if people are coming to receive some sort of service, do they have low physical and mental health, and so they need those services? Or in the case of the community breakfast and the use of this survey in a disaster, we're trying to figure out if people who have higher levels of engagement and social support and participate more in community groups and events like the breakfast maybe have better mental health after a disaster. So there's a lot of research showing that having a good network of support can be protective to your health if you are exposed to a disaster. And so that's what we were trying to look at there.
So, Dr. Horney, what is that publication, BMC Public Health? What does that stand for? What is that?
I'm not sure. British Medical Center. It's an international journal that publishes work on a variety of public health topics, not just related to disasters, but more expansive.
Now, so you said it's the British Medical something? You know that.
I don't know what it. It might be one of those things that doesn't stand for anything anymore.
Oh, okay. So, but the reason I bring that up is because that's where I saw the SF-12 study, that it was in that journal or in that publication, and it said BMC.
I guess it stands for Biomed Central, it looks like.
Okay.
So this is the public health version of that. So they focus on a lot of different public health topics, including chronic diseases and environmental health, but they also have a section which focuses on disaster and emergency preparedness. And so that's why we were targeting that journal as a place to publish this research.
So with research, what you do is once you do it and you have your findings and conclusions, you send it to different publications. Is that correct?
Yeah, so we'll do a lot of different kinds of research communication. For us as faculty members in universities, we need to publish our findings in peer-reviewed journals. So we find a journal that has that publishes papers related to our research. And so, I mean, people might be familiar with big journals like Science or Nature, but this one is one that focuses on what we're focusing on, and those findings are reviewed by a group of our peers, other academic people working in public health, and they make comments on how to improve the paper. We go through a lot of revisions, and then finally, and usually it takes a couple of years, that's published. The problem with those publications is that that doesn't get back to the community of folks that gave us the data to do the study in the first place. So we have to also, for example, I know we came back to the next breakfast and shared the results directly with people, because probably most of the breakfast folks don't have a subscription to DMC Public Health, which probably costs the library at Texas A&M, I don't know, $5,000 a year or something. So we have to be really intentional about returning the information we collect back to the community so that they can then take action on it. So that sharing in the publications, we also go to a lot of conferences where we present our work to other academics. But there are also conferences which Garrett goes to that are focused on community engagement. So they actually are sure that their audience includes both researchers as well as community members and stakeholder groups that represent them. And so we really try to present our findings in a number of different venues in a number of different ways so that more people can become aware of the kinds of findings that we have.
Well, it appears that you accomplished that with your efforts to send it out to peer review locations and communication periodicals or whatever, because from the way I understood it, your publication fell on the desk or in the eye shot of a freelance writer, and the freelance writer called me to interview me because she thought it would be a good piece for Scientific American magazine on resiliency and neighborhoods being overlooked, black neighborhoods being overlooked, their resources and assets and that kind of thing. So she submitted it, and I'm not even sure if you knew that it was submitted, and then it was the story was part of a resilience factor that Scientific American was doing cross sections of the United States, and that was one of the articles they put in there. And then this past summer, June of 2022, they ran it again in their special edition. Did you know that?
No, I didn't know about that, but that's a perfect example of how we want to communicate these findings in a lot of different ways. And one of the challenges of doing this work more broadly is that the incentives that are in place for different groups of people are different. So Garrett and I, as faculty member, we have an incentive that we need to publish in these journals and present at these conferences. That's how we get promotions and raises and, all those kinds of things. But that doesn't really mean anything to a community. So it's important that those things get picked up, maybe, gets reported in the Houston Chronicle or gets put on some kind of social media, because we've got to find people wherever they are to get those messages.
Yeah, and it also appeared in a premier magazine. It's maybe not necessarily has a lot of national notoriety, but it's called a trade magazine. They picked up an excerpt of the research and what we've been doing as well. So, Dr. Sansom, let's introduce you at this time to the audience, and you give us a little background on you and your areas of concentration in public health and at Texas A&M, and then let's just kind of have a round robin conversation.
Sounds good. Yeah, thank you so much for the opportunity to be here. I'm really happy to get to talk about this work and future work and just doing things together. So my name is Garrett Sansom. I'm faculty in the Environmental and Occupational Health Department at the Texas A&M School of Public Health. I'm also part of the Community Engagement Corps for the Texas A&M Superfund Research Center. So my focus is on environmental epidemiology, particularly within vulnerable communities that maybe suffer an undue burden of environmental pollutants, and then the negative health outcomes that are associated with those types of exposures. And that includes, events like major hazard events like Hurricane Harvey, but also human caused events like petrochemical fires and things like that. So when we put together this type of study, it was really kind of the first foray into realizing that engagement, particularly in this case with charity productions and these repeat events where people can come together, that even when public health, like your physical health, is at risk or you have lower physical health scores or abilities, that doesn't necessarily mean that your mental health needs to suffer quite as much as well. So again, thanks for having me here.
Now, let me ask this. How can you, do you also calculate the public policy and provider impact that you have once you have some positive findings that lead to improvements? Give us an example of how the city of College Station or Beaumont or Houston, how would you impact decision makers?
Well, that's an excellent question. And honestly, it's a difficult one to answer with any kind of real satisfaction. So what we do, and it was mentioned earlier, is we try to do the best science we can and the best scholarship we can, and then get those findings out to as many people as possible. Again, that includes the folks that actually provided the data, right? So coming back to the community and doing things like town halls and giving it out. But that also means trying to get this information to the eyes of policymakers or elected officials that then can prescribe some of these policy prescriptions that maybe can be pursued and pushed forward to actually improve long-term resilience efforts. So it's everything from having smarter urban planning to having opportunities to attend events like things with charity productions, but also having access to things like healthcare and local resources that should be available to everybody living in the country. So it really is a multi-pronged approach, some of which that we have some control over, and some of which are unfortunately out of our hands.
Well, let me ask you, are there any lessons learned or best approaches from like a hospital to a city government? Do you have any, do you have better acceptance from the private sector with the way when you come up with findings, or or is it equal acceptance when you dealing with a governmental entity versus the private sector?
So I'll give a little bit of an answer, and then I'll let Dr. Horney pitch in here if she has any experience with this. So the process itself is unfortunately long, and there's many different steps along the ways, all of which can fall apart. So just conducting the research itself, and then getting individuals either in the private or the public spheres to be able to take that research seriously, to be able to replicate that information, and then to be able to kind of get the will of the populace behind any sort of change and then actually move for positive impact. So what tends to work best in my limited experience with this is having real change be driven from the bottom up and through community organizations upward, as opposed to being dictated from above. And where I see myself in that picture is being able to provide the evidence that can help, and be able to talk about potential solutions with different groups, and then be able to give them the power to be able to push through and maybe make some positive changes whenever possible.
Dr. Horney?
Yeah, I would just add to that one of the stories that I always tell about how you're always learning if you're doing community engaged research. We did a lot of research on the potential for pollution after the Hurricane Harvey flooding in communities that had a fence line or had facilities that we knew had toxic materials in them. So if those sites were flooded, is it possible that those contaminants were then transferred into people's yards or the ditches and that sort of thing, and they could be exposed to them? And so working with some community groups in Houston, we had presented all of this. You know, we were looking at zip codes or census blocks, census tracts, even the super neighborhoods of Houston. And the community said, can you give us these maps by city council district? And we never would have thought of doing it that way. Of course we can, but they wanted, as Garrett's saying, what we want to do is give people the data that they need to go to their elected representatives, to go to their, community groups, to go to other places to advocate for what they need in their community. And they can't be dismissed as easily if they have sound scientific evidence showing these exposures. So, that was something that was very easy for us to do, and we never would have thought of it because we didn't, we weren't tuned into the political boundaries of the city. We were always thinking about other kinds of boundaries, zip codes or census tracts or even neighborhoods. And so I think that's a good story to say that we have to listen to how you guys want the data. The people who are actually on the ground developing the advocacy firsthand.
With that said, the zip code analysis that Charity Production is going to publish in October or distribute, we identified 25 zip codes, and it gave us a distinct pattern of where the vulnerable populations are geographically on a zip code map. And when you said something about ditches, let me ask you this question. Do you find, or in your research, did it ever come up, are neighborhoods that have ditches, does that create some type of health threat with the drainage situation and flooding and water standing? Are curbs and gutters less likely? Is that something that you just made me think of that when you said something about ditches? And in Sunnyside particularly, we've had problems or discussions or issues with the city and ditches and being clean to drain and culverts and all that. Is there a difference between ditches and streets and gutters? Curbs and gutters?
So I'll jump in here real briefly. So it's challenging to make a one-to-one comment on the specifics that you're mentioning.
Okay.
However, I can make a more general comment that proper urban planning and water infrastructure to get things like water out of your system that stops nuisance flooding or major flooding to some extent is certainly a public health issue. Also, something that's a public health issue is anything that can reduce the opportunity for certain types of exposures. One thing that we did find during Hurricane Harvey and several other different research groups have found in lots of different major flooding events, particularly in areas with dense industry, is it increases your opportunity for certain types of exposures. So having a well-built, smartly built urban planning infrastructure in place can lead to improved public health outcomes. Now, what the specifics of those things look like are really challenging to say with any kind of confidence, though.
So in urban planning, do you in the public health sector interact with urban planning that deals with generational threats or conditions, negative conditions, and when you make the plan, is there interconnection with public health and urban planning?
Yeah, so we work really closely with urban planning at Texas A&M, and I know that our colleague and the lead for the Superfund research program there, Galen Newman, has been heavily involved in charity productions and a number of the other activities. So we are definitely looking at how urban planning can improve the public health going forward, whether that is reducing exposure to environmental toxins, whether that is reducing exposure to metals or biological hazards like sewage overflow, and even whether that is reducing the opportunity for mosquitoes to breed that carry diseases like Zika and dengue that we're concerned about, that are either already locally transmitted in some cases like Zika, or that we're concerned that they may be reemerging in locations like Texas. So the whole, in the early 1900s, the fields of urban planning and public health were closely united, and I think they went in different directions for a long time, but the focus on climate and the unequal impacts of changes in climate and more frequent and severe disasters has really brought public health and urban planning back together to fight these inequities through better planning that can protect health.
Well, I mentioned this because I really see what we're doing, and I see the relationship growing, but I see it as a pioneering effort that closes a gap for information or scientific information that citizens and university research as a combination is a way forward for better planning and engagement between government and stakeholders. I see that, we've been connected now, meaning Charity Productions and Texas A&M, since 2008 or 9. So I see this, we are learning each other and dealing with the needs, and I really want to thank all the universities that we work with. I want to thank them for being part of what I see as a pioneering effort in the next 5 to 10 years. The concept of bottom-up and anchor institutions will become somewhat blended or more refined in how we work together and how we get positive results for communities that are labeled underserved with unmet needs and so on and so on. That's why I frame it as a political designation, because nobody wants to be underserved and nobody wants to be vulnerable. And there are many tools, and I see the scientific tool or mathematics and science is more of a coming of age, because even in the school system, they have a lot of schools put a lot of emphasis on science, technology, STEM schools, and math, engineering and math. So if the school systems are doing it, and they've been doing it for a while, it's only natural that the community gets involved in it and have a fresh, new look at science as part of a solution, whether it's public health, political science, whatever the sciences are, social sciences. We need to be more upfront and inclusive and engage with that. And I'm glad that Texas A&M is part of that movement and look forward to these other universities. Now, so Professor Sansom, what would you say as a future next steps of opportunities that you see that we could do with our efforts with Charity Productions, whether it's in Beaumont, Port Arthur, or Houston?
Well, from a research perspective, I think the opportunities are growing and ever more important that we can really find out specifically what's driving both negative physical health and improving mental health, and be able to sort of identify good areas in which we can promote to be able to really build resilience to both physical and mental health issues across the whole Gulf region. I think we're going to be seeing, unfortunately, increased risks for hurricanes over the years, major flooding events, human-caused disasters like petrochemical fires moving forward. So I think it's more important today than it was yesterday, and it's going to be more important tomorrow than it is today, that we, again, try those solutions moving forward. And I think the only way that can happen from an academic perspective is by linking with community partnerships like yourself, the people who are, really boots on the ground and actually moving the needle forward on a lot of these efforts. So I think identifying areas and identifying topics together as a team that we can begin to pursue together. I know that's a broad thing, but I think at this point, there's so many things that really needs to be narrowed down with each other. So that's what I would say.
Dr. Horney, what is the definition of epidemiology moving forward with looking at the various threats that we are looking at in when we say marginal neighborhoods or vulnerable populations? What is the correlation, the way forward, or what you see coming on the horizon dealing with epidemiology and solutions for those populations?
Yeah, I want to just also build on something that Garrett just said, which is that the only way this stuff gets done is through partnership and authentic partnership, because nobody has enough hours in the day. Nobody has the full scope and scale. So, maybe we know how to collect samples or analyze them in the lab, but we don't have any knowledge of, where's the place that actually floods every time there's a rainstorm. And so we only get this done together. So I think that is really critical, because it's hard and it takes a long time. And, coming out of the last few years, people are exhausted. And so, maybe when you're thinking like, do I really want to go to that community meeting tonight? It really takes all of us to do that. In terms of what epidemiology can do, I think we're the essential piece of all of this, because we study the health of populations. So we're not interested per se, like your primary care physician, and giving one individual a test and saying, your blood level is too high, we should give you a treatment. We're really interested in what the health of communities are and what are the drivers of that. So we talk about, not only the prevalence of health conditions like asthma or chronic kidney disease that we know are more prevalent in these communities, but we also talk about the determinants of those diseases. What does housing have to do with this? What does transportation infrastructure have to do with it? What does schools? What do other opportunities? What kind of businesses are in place in the community? What do all those things have to do with it? So, from my perspective, public health and epidemiology are the essential pieces of solving these problems going forward.
So, has there ever been, to your knowledge, that the epidemiology community persons in the community, epidemiology community, have they ever called for a public health alert? Or is it just left to city government people?
No, so public health agencies actually have quite a lot of power to issue public health emergency declarations, whether those are in association with an outbreak of a disease like we're now seeing with monkeypox or that we've just gone through with COVID, or whether that's because of an environmental contamination. And so I think that one of the things that is going to be most important for us to figure out over the next couple of years is that people have lost a lot of trust in their public health agencies and in public health authorities, and that trust has been undermined in many cases on purpose through the politicization of public health. And there really isn't any role, in my opinion, for politics in public health, because everybody deserves the right to be healthy. And it's not just for Democrats or Republicans or any other group of people. You know, where the zip code you live in shouldn't determine whether you have an opportunity to be healthy. So I think that we have to see how public health rebounds from some of the struggles of the last couple of years and being part of this enormous public health challenge with the pandemic. But I'm hopeful that the students that Garrett and I are training now are really energized about being part of solving the challenges related to environmental injustices in communities.
So with that said, Garrett, what about the direct relationship between public health and public safety, and where do they touch each other? Whether they come together either in conflict or in concert?
Yeah, that's a great question. So I'm one of those people that says everything is public health. So it's all one and the same to me. I'll say this. So like folks like myself and folks like Dr. Horney who study, disease and environmental contamination, there's also entire wings of people who study things like public safety in the public health sphere. So that includes everything from occupational health, how we set up our systems like OSHA, but also just how we have our workspace together. And it also can help, maybe not as much as it should, push things like, how policing can work. Like what's a policing issue and what's a public health issue? What's a criminal issue and what's a public health issue? But in the broader sphere, I think they're really all one and the same. It's about how do we improve the well-being of individuals so they can pursue a full and flourishing life, whatever that means for them individually. And so I think it absolutely has to be in concert with one another. Again, if our goal is to have healthy communities, healthy individuals, and healthy families that are able to, again, pursue their interests and needs. I don't think it's possible unless it's together. And there are some models that kind of play more into my desire within other countries and perhaps other states and other regions. And the outcomes of those places tend to be more favorable than if you don't take into account the more serious and public health issues as a whole, and then focus just on things like safety.
Well, when you mention models, are you familiar with the community participatory model? I heard you say bottom-up approach, bottom-up, top-down. I know those are two that try to work together. They have been grouped together in some instances. And then anchor institutions. Do you see universities playing a larger role, and not to say that the role changes but a larger role in providing the data for community groups to articulate, advocate for public policy? Because that is one of the things that I see and have seen is particularly in the Black community and then the Hispanic community as well. When I go to different meetings, we don't want to be embarrassed and upstaged by an elected official that may have more information than we have. So if we can have good, solid scientific data recommendations that has been reviewed or peer reviewed, I think that's going to be a major benefit moving forward for community folk to stay engaged. I see the research is part like a glue-on or a piece of glue that helps glue the process to stay together at the bottom and flourish. Do you see those combinations of models being beneficial moving forward?
Yeah, so absolutely I do. And this is something that, I mean, there's always growing pains and people make mistakes, and there's times that I could have done things better than other times, but it's something that I try to incorporate, we try to incorporate as a team into a lot of our research. So I think having not just, researching different areas, but actually involving the community from thinking about coming up with the research project all the way to helping disseminate that information and being part of the process of collecting it when possible really benefits not just the research itself, which it does, but it also has a benefit on the community because they get to be actively involved with the research process. So they see how that worked. Particularly, we'll sometimes target high school age students so they can get real citizen science experience. And hopefully engender a love of learning, so maybe they can pursue higher education where they wouldn't before. But then it gives the data collection process more in the hands of the community itself, so they're better able to both understand it but also use it moving forward. And it's a I think a growing interest with a lot of different research groups. I think the benefit has now been shown repeatedly that this is a better way of operating both ethically, but also it gives you better research and better results and better opportunity to push things in a more positive way.
Dr. Horney, did I understand you to say that you had not heard about the article based on your research, both of you all's research? You were not aware that it was one of the feature it was included in a feature article on resilience in the Scientific American. You weren't aware of that?
No, I was not.
You famous. Yeah, y'all famous already. But we have about 10 minutes left. So could you give us a prediction? Look into the window. Each one of you give us a window to look at, a goal to look for, a mission to complete in the next 2 to 5 years. How should we be positioning as partners with community and the citizens around data?
Yeah, I'll start if that's okay. I think we've got to build the coalition even broader. We are facing some huge challenges with the increased frequency and severity of disasters, such that as more and more people are impacted, people are no longer going to be able to say this is somebody else's problem. This is a problem for poor neighborhoods. This is a problem for Black neighborhoods. This is a problem for absolutely everybody. And little by little, it becomes clearer to everyone that that is the case. So I think that we have an opportunity now to begin to act on the trajectory of that going forward and try not to repeat the mistakes that we've made in the past with things like redlining or things like segregation, but it's a heavy lift. So I think while we're doing the work, we have to continue to recruit new collaborators, recruit new supporters, because the solutions that we do have, like you talked about some of the green infrastructure and some of the urban planning, they're expensive. And we need everybody on board to say, for the future of all of our communities, we have to invest this money to make everybody more resilient. So I think sometimes this work can be hard, but we have a lot of opportunities to succeed and to protect people's health going forward.
Dr. Garrett?
Yeah, so I agree. I'll try to not just say the same thing. But when we put together, I think, our broader networks, and when we begin to work together, I do think we would benefit from having a strong understanding of our own expertise and our own limitations. So if you were to ask me how to convince an elected official to do something, I'm not that person. I'm not good at that kind of thing, right? But we can talk about the science, right? Whereas you might be very good at persuading individuals and pushing for a specific cause. So I think together is the way in which we need to be operating, and the way that we put together that infrastructure, like make sure the people that need to be at the table are at the table, and then coming up with the ways in which we're going to continue long-term the engagement. I think we have a lot of good examples. I think it's been a real benefit and a wonderful experience getting to work with folks like yourself for so long. But then sometimes other organizations, it's difficult to maintain that relationship. And so I think learning from our past, putting together a meaningful team at the table, having these networks work together, and sharing in the expertise from community members to stakeholders to local movers and shakers, as well as the moved and shaken, and then folks like academics, are really kind of the path forward. Part of the problem is a lot of the incentives that are received aren't necessarily for these kinds of things. So while maybe I disagree with some ways in which certain people operate in communities when they do research, at least I can understand it, because it is difficult to do a lot of this work. So I think the academy and academia in general has some work to do on itself as well, to make sure that we're pushing people towards the kind of outcomes we want. And that includes changing up the incentive structure a little bit as well. I hope that answered your question a little bit.
It did, and I think that was a good note for us to close out on this segment of Scholars, Scientists, and Practitioners series for charity productions under the banner of community science. We want to thank Dr. Jennifer Horney and Dr. Garrett Sansom for being with us today. And we look forward to this series to continue. We have about 30 different scholars and scientists and practitioners that we have reached out to, and we're scheduling them as soon as we can to complete the series. We want to thank you for being with us. Your host, Charles X. White, Charity Productions, Community Views and Solutions. We'll see you next time with a lot of math and a lot of science. Thank you.